This is Channel 6 TV Community Focus. I'm Dennis George, and today we're at Springview Hospital and alongside the CEO of Springview, Tim Trottier. And Tim, welcome aboard. And glad to have
Dennis.
you. You know, a lot of things that we know are going on here at Springview, and probably a lot of things that people in the Marion, Washington, Nelson County areas don't know about. And you know, I guess one is we think about it. A lot of people have trouble sleeping during the night and what have you, and you have a sleep center here now. Do you want to talk about that for a little while?
I would love to. Thank you. Sleep apnea is a diagnosis that our medical staff felt is relatively underdiagnosed among our population. And I myself, I don't mind saying, have been diagnosed with severe sleep apnea. And if you lie next to somebody at night who snores loudly, who you're fearful may have stopped breathing during the night, those are classic symptoms of sleep apnea. Also, if you have somebody who is tired all the time, you sit them down in the chair and they fall asleep. That's another symptom of sleep apnea.
All right, but Tim, it seems like a lot of times we think, I'm getting older, I worked hard today, so maybe some of the things that we would think is just natural, there's something else there, is what you're saying.
Exactly, and really, and I'm not clinical, but I've been diagnosed with this, so I understand it. You're not sleeping as deeply at night. That's causing you to not rest fully. So your body wakes you up a little bit because you've stopped breathing. And you may not wake up enough to remember it, but you wake up enough to interrupt your sleep cycle that causes you to have sleep apnea. So we get you into our center. It's an overnight study, so the most thorough of the studies that are available. It's not a home study, it's a thorough overnight study. And if diagnosed with sleep apnea, we've got great folks in our community who offer durable medical equipment supplies. They'll get you set up with the right machine and you'll sleep so much better. The person lying next to you will also be very grateful because they're not having to listen to all that noise while you're sleeping.
So maybe that's the person who pushes an individual to go get checked.
Exactly.
Right?
More often than not, it's their best referral source. It truly is.
All right, so you know, and I've heard of these machines where basically you go in at night, put a mask on, hook up to a machine, and I mean, do you use that yourself?
It's called the CPAP.
Okay.
And it forces oxygen into your lungs so that your body, when your breathing cycle is interrupted, your body doesn't stop and wake you up so that you breathe. It's a continuous stream of oxygen.
All right, for those who may have it and understanding you're not a physician and the medical end of it, you probably know just enough to be dangerous. But for someone who has it, is there a danger to that, or is it more long-term benefit, let's say?
Gone undiagnosed, it increases your risk of heart disease and other things that just it should not remain undiagnosed, and that's pretty commonly accepted among the medical community and among insurance companies. We rarely see issues with insurance companies relative to certifying the study and certifying the equipment that you need if diagnosed with sleep apnea. Okay. It's very well accepted.
So it's not like you're going to be out some great out-of-pocket. Your insurance isn't going to cover any of it, and then may persuade some people not to go through the test then.
Typically not. That's correct.
Okay.
Yeah.
All right, let's talking about insurance. Open enrollment, I guess, is upon us for the Affordable Care Act, Obamacare, however you want to describe it. Do you want to talk about that a little bit? And we'll stay out of the politics of it.
Sure.
But talk about it and what people can.
Yeah, and I don't even mind getting into partisan issues if you want to talk about that as well, because I mean it's a factual conversation.
Okay.
Let's start by talking about Kentucky as it is as a whole. Kentucky has agreed to expand Medicaid. Not all states have done that. It tends to be a blue rather than a red issue. Is that okay?
You're fine.
Yeah. And
you're saying it, not me. Okay.
I mean, it's just a fact, and we really Kentucky has jumped out in front with Medicaid expansion, and in 2014 we saw the benefits of that in our state, in our community, in our hospital. We saw a number of patients who literally were undiagnosed, who now, because they have access to Medicaid, showed up and received care, and not just showed up, but showed up sick. And we were able to bring care to these good folks, and it's been a great thing for our hospital and for our community.
And from what I understand, these people, before we weren't insured, were showing up at the emergency room, maybe not real sick, but that was the first place they would go because they didn't have insurance.
And interestingly, they continue to show up at the emergency room. It appears that this patient population is not a population who they like the ER. They like to come in and be seen right away.
All right, we hear that the act has not been good for hospitals, and obviously and others in the medical community. You're part of a healthcare organization. Do you all see that it's been good for you and for your bottom line, or how does that work out?
I can speak to this hospital, and for this hospital, it's been a very good thing. And what it's done is we treat everyone who shows up in our emergency department, regardless of their ability to pay. We see them all. And we historically have had an 8 to 12% self-pay insurance population, which usually means they don't have the means to pay. That 8 to 12% has evaporated, and who was previously a self-pay is now Medicaid, because the state has opened the criteria for people to qualify for Medicaid.
All right, as we talk about open enrollment, I guess through the end of January maybe.
Right.
Do you know a lot about that? I know that's not something you all are real involved in, but can you talk about that for a minute?
Yeah, and let's clarify what we're talking about. Yeah. Medicaid is a program for indigent patients who meet certain criteria in terms of their household income and don't have the means to pay for insurance. What you're hearing about with open enrollment on the Kentucky Insurance Exchange is insurance products available for purchase at a much lower rate than what an investor-owned commercial insurance plan may be made available for. So that's the difference. It's an open enrollment for people. And what you're seeing folks do is you're seeing people who have insurance through their employer. The insurance through the employer requires a copay or requires a premium contribution. The premium contribution is more than what the premium might be through an insurance product on the exchange. So people will elect not to purchase insurance through their employer and purchase it outright on the exchange. So that's the exchange product, and that's the open enrollment that we hear about. Now here's the issue. We just saw this. The Kentucky Cooperative Exchange, who was the largest exchange in our community where people were enrolling, that exchange just announced maybe 3 weeks ago that they were ceasing operations on December 31.
And we've been hearing that in the governor's race as they talk about the issue. So
exactly.
Okay. How does that affect, or will that affect people in this area, or will it open up for other competitors?
People will have to. They won't be. People enrolled in that exchange product will have to change, and they'll have to make a decision. If available to them, they'll have to re-enroll in their employer's insurance option if they have that, or find a different insurance product for coverage.
All right, at one time, 10, 15, 20 years ago, the number of companies who were providing health care insurance in the state of Kentucky was dwindling, and there wasn't as much competition. Under this act and under the exchange, are there plenty of companies offering insurance, or is it a competitive market?
It's a competitive market to a degree. The philosophy behind the insurance exchange as it's designed in the Affordable Care Act is because it's a quasi-government run, the need for profit margin is removed from the exchange. So when you go to an investor-owned commercial product, built into your premium is a profit margin. By going to this quasi-government owned product, that profit margin doesn't exist, therefore conceptually the premium should be much lower. Now the counter to that, and you've seen those who oppose the Affordable Care Act come out and say this is what we were fearful of, because the cooperative was not able to sustain itself, and is shutting down December 31.
Okay, so the response from those on the other side would be others will be there to pick up those customers who are left with that exchange gone?
And I hope they're right.
Okay.
The question will it be at the same premium rate that the previous cooperative was charging?
And I guess even then, there's a number out there that even if it goes up, it's still worthwhile. There's a number, in some instances you would call it diminishing return, but even if it goes up some, it's still worth having until it gets to a point that it's not affordable at all.
But if you're one who might have insurance available to you through your employer, you may find yourself going back to your employer's insurance rather than to an exchange product as they reprice the exchange product.
So in that situation, you benefited with lower premiums for a few years, and you're going back to where you were before in some instances then.
Right.
I got a question for you. As I spend time with friends in Campbellsville and I come driving down the road, I see a billboard over on the left-hand side for Springview Hospital. And it tells me, I think, because I don't want to look at it too closely, so I want to pay attention to the road, there's a 7-minute wait in the emergency room. Is that what it is?
That's right.
Talk about that. I mean, I'm sitting there thinking, wait a minute, I'm in Campbellsville. How's this billboard know it's going to take 7 minutes wait in the emergency room? So explain that to any people who go to.
Are you a gadget guy, Danny?
No, no, not at all. So I'm gonna, it's people like you that have to tell me about it.
You bet. Well, let's go to the emergency department first.
Okay.
The emergency department has a pretty sophisticated computer system that helps us track our patient flow. So there's a screen in my office right now that shows it's a map of my emergency department with every bed and every patient in that bed right now. We can go down there and look at it. So we track it. We track through this computer system when every single patient hits our front door, when they are brought back to the room, when the physician sees the patient, when tests, whether it be lab, imaging, respiratory tests are ordered, when the tests are administered, and then when the patient is discharged, either to a bed upstairs or out the door or to another hospital with a higher level of care. So we track all that through the computer system. We have taken that computer system and through an internet connection that we've purchased to be on that billboard, we transmit the time from when the patient presents until when the physician sees them.
Okay.
And it's a 4-hour average.
Okay.
We transmit that time, real time, to the clock that's on that billboard. So we want folks to know, well, number one, we take that time very seriously.
Okay.
And we have a lot of processes in place because we believe when someone shows up to our emergency department, the quicker they can be seen by a physician, the better their care is going to be.
All right, it appears to me as an outsider looking in that when your people know this is being tracked, it makes them more fully aware of the timing issues. And that's not to say that before it was being tracked, this isn't the right way to say it, they didn't care or they weren't as cognizant. But when you're tracking it and they know you see it and everyone sees it, does that make them a little bit more aware of, hey, let's see how good we can do, how low we can go? Does that play into the performance at all? Because I know this is a different type of situation than a lot of things would be.
Sure, and I would say at the person at the bedside, we've got great folks there, and they're going 100% all the time regardless.
Right.
And I would say the same for our physicians and our clinical folks. For our leadership, it's really challenged the leadership to say, how can we do a better job of streamlining processes to make it even easier for our staff at the bedside and our physicians to get to those patients more quickly? So yes is my answer to your question. And we've seen a dramatic decline in our door-to-doc time prior to putting the billboard up. We worked for a year in refining processes.
So, but you were aware before the billboard went up, you're kind of tracking it before you went to that
Correct.
step then.
Yes. Our threshold was 20 minutes average for a 24-hour period. And we waited. When I first started here in January of 14, we were at 40 minutes average. It took about 9 months to a year with a lot of energy and commitment by good people back in our emergency department to get it to 20 minutes and below. And we held it there for a solid 8 months before we put the billboard up.
Basically, you want to be confident that people were confident in coming to you type thing?
We wanted to make sure that we could deliver on the commitment and that our processes were hardwired before, you've got to be able to deliver on what you sell, right?
And that's
what you advertise.
And I guess almost before, back in the, prior to you all doing these studies, you may not know how long it took people to go through the process. Or maybe you saw somebody on the street who complained to you that somebody went to the emergency room and it took them 2 hours to get through.
Couldn't even see the doctor.
Yeah.
And it's well, let me tell you another metric that we measure, and it correlates with door-to-doctor time. We measure patient satisfaction, and we do it through a sophisticated survey process where a third party calls on the phone 90 patients each quarter, and we call 90 ER patients, 90 inpatients, and 90 outpatients. And we ask them about 23 questions. And those questions are common to everyone with this third party that we use. So there are about 750 hospitals signed up with this third party that we use. And we compare our responses to the other hospitals' patient responses. And we look at where our scores fall relative to other hospitals that we compare ourselves to. And our patients' overall response, who were seen in our emergency department, are higher than 75% of the patient responses at these other 750 hospitals. And they weren't in the 75th percentile back in January of 14 when we first started this initiative. So a dramatic increase in patient satisfaction driven by a dramatic decrease in door-to-doc time. And the third metric that ties into this, our ER patient volumes are going up. So I think people in our community understand that if you come to our emergency department, you'll be seen quickly and you'll be very satisfied with the care you receive. And we get rewarded with more business because of that.
We're doing this for Channel 6 TV. Is that something that you guys are using in marketing tools, or how do you get that word out other than shows like this?
Okay, TV guys. I'm sorry, TV guys, especially your salespeople. I asked this question to our volunteer group yesterday. I said, how many of you in the room, by a show of hands, chose the last doctor or the last hospital you went to because of the ad you saw on TV? And not a single hand went up. How many of you chose the last doctor or hospital you went to based on an ad you heard on the radio, not a single hand. Based on an ad you saw in the newspaper, based on an ad you saw on a billboard, not a single hand went up. How did you pick the doctor or hospital? And you know what they said?
That's who we always went to.
Or word of mouth.
Yeah. But that word, as it gets out, is also gives people confidence in the product that you're putting forth as well.
Exactly.
You know.
So by driving high satisfaction, we think the word of mouth mechanism for communicating where folks should go has worked for us. And that's our primary tool for getting folks to come here and choose our hospital when they have a choice about where they go.
Okay. We're getting close on time. We understand you have a new orthopedic surgeon in town.
That's right.
And I guess that's part of the process. You as an administrator and others with the facility, always looking at the needs of the community and trying to bring in more specialists. And I know Gary wants to talk to him sometime and do a little feature. Talk about your new orthopedic surgeon, but maybe also the process of how you gauge when you need new people and what type of people you need to bring in.
Thank you. Yeah, great question, Dennis. First off, we have a very formal mechanism, and it's a common mechanism in our industry to calculate physician needs for a community. So we have a physician needs analysis, and our needs analysis shows that we needed another orthopedic surgeon. And I wanted to make sure that we got the right orthopedic surgeon. So we went to great lengths to create the recruitment tool. We had candidates, we screened our candidates, but you know, the most important, in my mind, one of the most important measures of getting the right candidate were the primary care physicians in our community. So when we brought Dr. Vias out for an interview, I invited all of the doctors in our community, and the vast majority of them showed up with spouses to my house. And we had Dr. Vias, his wife, and their 4-year-old little girl, who's just a firecracker, by the way, is delightful. And we had a wonderful dinner. He came to that dinner at my house that night with our medical staff as a candidate. He left that dinner as family. So when I looped back with the physicians, I asked the question, okay guys, is this our guy? And the response from them was, Tim, we think he's great, we think he's a nice guy, we think he'll be good with our patients. However, he's a surgeon. How do we know his hands are any good? And I said, that's a great question.
The personality fits. How good is he at what he does then?
Yeah, and surgeons, you got to have good hands. So what we did to answer that question, he was finishing his 4th fellowship in Miami, Florida. So we took our OR nurse director, asked her to get on an airplane, fly to Miami, physically go into the operating room in Miami, into one of his cases, and observe him doing surgery.
Not a recorded one, but live?
She hands-on watched him do a surgery, and this was a plan that the medical staff had endorsed to gain confidence that his hands were as good as his personality. So she did. She went down there.
She got a nice trip out of it.
She did. Yeah, she came back. She said, "Yeah, he's got the hands." And what was even more fun about it is she added to that, and he's going to love our OR staff far better than what he's getting down there. So, which I think he does.
But when you bring someone, if he was in Miami, is it difficult, not just for the physician, but families, to come to a small community where all those extras aren't here? Is that a selling point to the wives? And I guess that's why you have physicians' wives and their wives come, because if mama ain't happy, ain't nobody happy, as the saying goes. Is it difficult to get people to come to a small community?
Not always difficult. I would say different.
Okay.
And part of our search with Dr. Vias was to make sure that this was a candidate who was interested in being in small town America. And if you look at the conscious decisions that he made through his training, his personal goal was to be in a rural community within 1 to 2 hours of a major academic institution. And so when our opportunity lit up on his radar screen, he saw U of L, hour and 10 minutes away, UK, hour and 10 or 20 minutes away, and he was all over us.
Okay.
So it was really a nice fit for both of us. His wife, by the way, is a dentist.
Okay, so opportunities again.
Exactly.
Along that line, and obviously if she's following, has been with him, she understands his desire for small town as well.
It was important as we developed this search criteria that we not only find someone who wants to be in small town America, but also someone who we felt would stay here for the long term. We didn't want a 3-year doctor. We wanted somebody who's going to be here for the long term, and we believe that Dr. Vias is that fit for us.
Good, and I guess that's an opportunity again for Gary to bring him in and another way or through our process to interview him and introduce him to the community.
You'll enjoy meeting him.
Well, Tim, we appreciate your time.
Thank you, sir. Great to see you, Dennis.
It's always good. And
yeah.
for Channel 6 TV, Community Focus, I'm Dennis George.